Hello, my name is Marta Garcia, and I am the leader of the healthcare procurement team for the United Nations Secretariat. Today, I want to talk to you about a very important subject, which is the UN supply chain management strategy in pharmaceutical logistics. This is a very important subject, and we are very happy to be part of the Pharma Logistics Africa and want to share a little bit more information of how the UN Secretariat works and the relationship with supply chain management in the pharma logistics sector. The United Nations, it has its clear mandate to help people all over the world. The United Nations Secretariat is helping the Secretary General to implement the purposes of the United Nations, which is to promote economic social development, promote human rights, and maintain international peace and security. Our main mandate and work is UN peacekeeping. UN peacekeeping helps countries navigate the difficult path from the conflict to peace. We have unique strengths, including legitimacy, burden sharing, and ability to deploy troops and police all over the world, integrating them with civilian peacekeepers to address the range of mandates set by the United Nations Security Council and the General Assembly. We actually keep the peace with more than 130,000 peacekeepers in 13 peacekeeping operations all over the world. And these peacekeepers protect civilians, actively prevent conflict, reduce violence, strengthen security, and empower national authorities to assume these responsibilities. This requires a coherent security and peacekeeping strategy that supports the political strategy of each country. UN peacekeeping helps host countries become more resilient to conflict, laying the groundwork to sustain long-term peace, including addressing root causes of conflict. This cannot be done without operational support, without somebody trying to bring everything that is needed so these peacekeepers can do their work. It's important to understand what you need to do to engage or work with the United Nations, and to understand that the United Nations is everywhere and it's not a single entity. It is a common misconception that the United Nations is a single entity. The United Nations is made up of different organizations and entities, funds, programs, specialized agencies, and in Secretariat, which is where I work. Specialized agencies are distinct and separate in mandate, covering political, economical, social, scientific, technical, and humanitarian fields. For example, the World Food Program, who just won the Nobel Prize, has a mandate to provide food for people to not go hungry all over the world. UNICEF is working towards the development and protection of children. UNDP, the United Nations Development Program, is focused on the development of countries and trying to reduce the poverty breach. It's important to find the best match depending on the goods and services you offer. You may need to identify UN organizations that will procure your goods and services. In the case of pharma, it's important to note that many organizations do purchase pharma, but the biggest purchasers of pharma are WHO, UNICEF, and the United Nations Secretariat, as well as UNFPA. Supply chain management in this organization, the United Nations Secretariat, is super important. And as I said before, we purchase over $30 to $40 million a year in healthcare category. And so it's important to understand how it works and the relationship it has with peacekeeping. The Office of Supply Chain Management, where the procurement division is located, is part of the Department of Operational Support, DOS, helping peace operations succeed by providing supportive solutions that are rapid, effective, efficient, and responsible. It works together with UN and non-UN partners to mobilize and sustain over 36 peacekeeping, special political, and other field missions all over the most complex environments in the world. Today, DOS helps administer a combined budget in a year over $7 billion. DOS provides operational support to all entities, not only peacekeeping, including advisory and operational transactional support services where needed for over 100 entities all over the world. We're responsible for supporting all the small United Nations offices and to provide healthcare support and implementation of the healthcare policy all over the world. It's important to understand that DOS, the Department of Operational Support, is in charge of overseeing the delivery of healthcare services in the field duty stations and addressing patient safety issues in this context. It's also in charge of coordinating the implementation of the healthcare policy throughout the United Nations system. The role the Office of Supply Chain Management has in this is with our recent merge of logistics and procurement teams to find supply chain success and to produce healthcare supply chains that are uninterrupted. Internal restructure brings the values in our global strategic plans, robust category management approach, and a framework of global freight forwarding to fruition. Our vision is to provide efficient, agile, responsive, and accountable end-to-end uniform capabilities and supply chain solutions to our global clients and partners. To enhance our vision to support clients and partners globally in fulfilling their mandates by providing goods and services that they need, when they need them, where they need them, and at the best price. Where do we work? As we said before, we support 36 peacekeeping operations in over 30 countries, 14 peacekeeping operations, 21 special political missions, and others. Our budget is over $7 billion, and we look to support over 139,000 uniformed and civilian personnel. Peacekeeping procurement, healthcare supply chain management is fundamental for the peacekeeping operations and special political missions located in very complex situations all over the world. As we saw in our previous slide, we have a focus in Africa, working in Mali, Congo, Somalia, and others. The major medical commodities that we procure are the following. The UN buys over $30 to $40 million in healthcare products and services. Out of these 30 to 40 million, 9 million correspond to pharmaceuticals. We purchase vaccines, a large number of vaccines, as we have our own vaccination programs for the peacekeepers, outsource medical personnel whenever we cannot provide, we do not want to enforce our peacekeepers in local healthcare system. So we provide our own clinics and hospitals. And for that, most of the time, we outsource our medical personnel, bringing in doctors, paramedics, nurses, and anything that is needed into a compound for the peacekeeping missions. We also engage our medical evacuation teams, which will bring any person that is injured or hurt or sick into higher level for hospitals for treatment. We purchase blood products as we conduct emergency transfusions if needed for any peacekeeper or any part of the UN compound. Drugs for malaria, drugs for surgery, basic care drugs, a large variety of pharmaceuticals, which are not these three specialized categories, to fundamentally store and in our clinics. And it goes from an antifungal to an antiretroviral. That's the range that the UN purchases in pharmaceuticals is high, and for the volume and the amount of money that we purchase. We also purchase medical equipment and medical consumables to go along with all these other commodities. What pharma do we buy? The UN engages suppliers capable of providing a wide array of pharmaceuticals, including analgesics, anesthetics, antibiotics, anticoagulants, antihypertensive, anti-ulcers, diuretics, cardiovascular drugs, etc. Our basic care category is pharmaceuticals for our UN level 1 clinics, our very simple clinics that are outposted in many small camps. And for that, we buy basic drugs, even over-the-counter drugs like paracetamol, but also dexamethasone, loratadine. Anything that is needed for these small outpost clinics is bought by our team in the United Nations Secretariat. The drugs for surgery are drugs for our enhanced medical facilities with surgical capabilities. We do have small damage control surgeries and enhanced surgical facilities to try to save life, to conduct life-saving surgeries for further ICU hold and evacuation with our aerial medical evacuation teams. There's also a huge amount of purchase of drugs for malaria, a list of about 10 items that are purchased very regularly to try to protect the peacekeepers and the civilians in places where this is latent. There are many, many challenges in pharma logistics, and I'm sure that many of you are already aware of it. In the United Nations, we have a strategy to try to overcome these challenges, and this is to find efficient, agile, and client-oriented, accountable contractors that will work with us in minimizing counterfeit products that is latent all over the world, and connecting with specialized wholesalers and manufacturers that will provide uninterrupted supply chain. The improvement of cold chain shipping is very important for the United Nations. As we've said before, we work in very complex environments and in very complex climates. So the maintainment of the cold chain shipping from our partners is fundamental. Demand management and inventory management and distribution is a key part of pharma logistics. If we don't know how much we're going to need, we cannot plan for orders to be delivered in time. And for orders to be delivered in time and associated to inventory management and distribution, multiple sourcing options have to be found to avoid supply chain disruptions. So this forum is very important for us to find new suppliers to expand our supply chain for pharmaceuticals. Innovation in alignment with the Sustainable Development Agenda, finding suppliers, be it distributors, wholesalers, or manufacturers of pharmaceuticals that are connected and engaged to finding new, better, sustainable ways to produce pharmaceuticals, including packaging, are very fundamentally important for the United Nations. For us, it's important to find companies that are organized, that can function sourcing, storage, shipment, and quality control of drugs to ensure that what we're receiving is a fantastic service to support our huge humanitarian mandate. Part of the work that we're doing is trying to create a structure to try to enhance pharma logistics and have safety within these pharma logistics. The provision of pharma products for peacekeeping missions are to cater for the mission's routine emergency requirements. What usually happens is that we have missions that are already set up. We also have missions that emergently come up that the United Nations Security Council approves today, that a mission needs to be ready in the next 4 months, and we need to bring a hospital. And for that, we need the pharma. So it's important to distinguish our routine requirements from our emergency requirements. We require suppliers that are actually able to commit to routine requirements and also to our emergency requirements. COVID-19 is an example of emergency requirements where certain pharmaceuticals that weren't actually purchased in large volumes were required in larger volumes and in quicker ways. So finding pharmaceutical vendors in Africa is fundamental for us to have a shorter delivery period and a shorter restock period for our missions. Requirements of processes to ensure adequate stocks, therefore, are asking us to look for suppliers that do have great adequate warehouse management systems. This is fundamentally important for the emergency requirements. Missions will always have a demand management and inventory management to produce orders that are single for their restock. But there's also emergency. So having adequate warehouse management allows suppliers to support us better and therefore enhances the efficiency of our supply chain. The UN sets up contracts to ensure relationships with vendors based on estimates of annual purchases, which do not commit the organization for those specific orders in the year, which could go higher or could go lower, but ensures that there's a relationship established that doesn't need to go through a procurement process every time an order is placed, and provides increasing access of missions through quality pharma products. Therefore, contractors are awarded a list of items for specific orders from missions, and we ensure that to let our contractors know that we have embargo exceptions for delivery of goods in certain countries where it's very difficult sometimes to deliver goods. Our mode of shipment for drugs to ensure that they are delivered in a timely way is air, with delivery at place for emergency orders and free carrier for regular orders. Packing is fundamental and should be done in accordance with WHO good practices, distribution practices, the UN recommendations on transfer of dangerous goods, and regulations of the IATA rules on dangerous goods. Quality standards for drugs are a way of fighting the challenge of counterfeit drugs and purchasing drugs that might not be adequate for our peacekeeping missions. We have a mandate to protect our people's lives and to protect our peacekeepers. So we require all our contractors to provide items, pharmaceutical items that are produced and delivered in compliance with the good manufacturing practice of the WHO, GMP, and the good distribution practices, respectively. WHO requirements for collection, processing, packaging, labeling, and quality control for such products is also mandatory. We also request from time to time on a random basis a certificate of origins and certificate of analysis of certain items. And we conduct certain face-to-face reviews of warehouses and facilities of our contractors to ensure that these are actually being done. We also require updated the GMPs and GDPs for all the items. Contractors need to provide us with necessary information on our products and controlled substances, as well as we take care of import licenses. And the timely provision of certain information for this will actually provide us with a quicker delivery inside the missions, even when it's already been delivered by the vendor. One of the key aspects for quality standards for the United Nations is the shelf life of its items. When we place a contract, we try to have a good relationship with our suppliers so they know that purchases will be coming up and the volume that might be come up. And we request that the shelf life of the pharmaceutical items are 80% of the original shelf life remaining. Of course, when we have a list of items, we request to know what the basic shelf life for each item is, so we can, in receipt and inspection, we can check that. All drugs should be labeled in English language using generic nomenclature in accordance with WHO standards, and the UN must be notified when any drug is withdrawn from circulation due to adverse reactions from its use. No product is purchased if certificates are not submitted. We really request people to be serious about this, and we understand that there are many distributors out there and manufacturers out there. So we encourage all the suppliers to find ways to comply with these requirements, because there is many business that can be done with the United Nations. And if we can reach the quality standards that we have and accountability from our suppliers, we can build strong relationship with African suppliers. Currently, we have some African suppliers that are already on contract, but we're always open to find new ones. And we hope to see some of you in our one-on-one meetings to establish a new partnership and relationship with the United Nations. Thank you very much.